Well, good morning and welcome back to the Broadcast Retirement Network. I'm Jeff Snyder, and this is BRN Weekly for Saturday, August 1st, 2020. And our top story today, getting America's children back to school again. And joining me now to discuss this and a lot more is Dan Domenech. He is the Executive Director of the AASA, the School Superintendents Association. Dan, welcome to the program. Thanks so much for joining us this morning.
You bet. Thanks for having me, Jeff.
Your organization has a deep, rich history of advocacy and work with school superintendents. I mean, you were founded and organized over 150 years ago, right after the American Civil War. So you have a deep breadth of experience with educational issues. And there's so much going on with this COVID pandemic. Parents have had their kids not go to school. They're doing some homeschooling, virtual learning, et cetera. But I want to get your sense for what it will take to reopen America's schools district by district around the United States.
Well, that reopening process has been long in the making. I have been working with our superintendents from around the country since late March, when it became apparent that all schools were going to be closing for the school year and then planning to reopen. And I have to tell you that it has evolved over the last couple of months, and it continues to evolve.
Yeah.
The plans that we originally developed, and again, these plans were developed in conjunction with a team of 30 well-known established superintendents from all around the United States. The original plans really had three models. One model was that the situation by the beginning of the school year, remember, we're thinking this is like late March, April, things were going to be fine, and we would resume school as always, no problem. Mm-hmm. Number two was that there would be still traces of the virus, and so this hybrid model came into being, a plan where in order to abide by the CDC guidelines, social spacing would be necessary, keeping students 6 feet apart in the classroom. What that immediately suggests is that you can't possibly have all of the students in the school at the same time. You can only have part of them, and let's say half of them, okay? That the average classroom that holds 24 students, you can only have 12 in that building. So that hybrid model became a model 2. And youngsters would flip. Every district would set a schedule. Group A would come in Monday, Tuesday. Group B would come in Wednesday, Thursday. And on Friday, everybody would be doing remote learning. And then the third model was remote, totally remote. Schools would not be able to open. Nobody believed back then that any district would be doing that. Mm-hmm. We all thought that it would be that hybrid model predominantly. Today, as we see what has happened, the situation has not abated as we thought it would. If anything, it's worse and getting worse by the day. And so what most districts are now planning to do at this stage of the game is remote learning. We see that now happening all over the country. I can tell you that 2 months ago, I had districts in the South, including Florida, that were saying, we're just going to open, as usual, everybody come. No social spacing, no face mask, we're just going to open. Those very districts today are saying, no, that's not going to happen. We're not going to open. We're going to open on remote learning until the situation changes. So that's where it's at. We don't know what will happen, but we can tell you right now that where a lot of districts were talking about opening as early as August 7th, that now has been pushed to later in the month, the latter part of the month. And in the Northeast, where districts usually open up after Labor Day, we're seeing a lot of those districts saying we're going to open up later. And many districts saying the entire first semester is going to be online. For example, I live in the Washington, D.C. area. That's where our offices are. The D.C. school district just announced that this entire first semester is going to be online. And just about all of the major school districts in the D.C. area will be opening online until further notice. So that's where we're at today. We're seeing that the majority of districts are saying they're going to open online. Many of them are saying that they will try the hybrid model first. And it all depends, again, on the spread of the virus in their community.
Yeah.
And the guidance primarily is 5%. If you're under 5%, you're good to go.
Yeah.
If you're over 5%, you better be careful. If you're over 15 or 20%, don't you dare even think about bringing kids into the school in person.
Yeah. And Dan, you make some really, really good points. And one is that this virus, it varies district by district within every state. And so you could have different results in different parts of the state that would dictate when a school district could possibly reopen. The other is it's a balancing act, right, about reopening, because you've got not only the children and the parents and the families, but you've got school teachers, administrators, other people, janitors and support staff that could be at risk here. And I have to think that part of your discussions really is how do you balance all that? And there is no, let's face it, there's no perfect solution here because everyone's got to compromise here at the table.
Yes, it's very complex, but to simplify it as best we can, it all comes down to the guidance and the spread of the virus. If the spread of the virus in your community is large, and again, I mentioned those figures before, 5% or less, you're good to go. Over 5%, over 10%, it's a different story. So what most of our superintendents, and probably all of them, except that I can talk a little bit about the pressure that they're under, but most of them want to follow that guidance. They want to make sure that when they open their doors, it's going to be safe for the children and it's going to be safe for the staff. Now, there's a lot of talk we hear, the push to bring the children back. And by the way, we all want the children back. That's what school is about, having the children in school. We all want them back, but we want them back safely. Now, there's a lot of talk about that the spread of the virus and the influence on the effect of the virus on young children is less. Children 10 years or less, that's a South Korea story. Well, that may be true. And it may be great for those children. But they're saying that children above the age of 10 spread the disease as well as adults do. But here's the problem. That's fine for the children. What about the adults in that situation? What about the adults in that building? Staff are going to get sick. Teachers are going to get sick. Yeah. If a teacher gets sick, who's going to replace them? It's not like there's a bench of teachers sitting there waiting to run into the situation. If anything, it's the opposite. What we're getting from our members, our superintendents, is the staffing is a big issue. When they've done survey of their teachers, over half of them indicate that they will not be back in the classroom because their age or they have medical factors. And so they're saying, we'll do the remote portion of instruction, but we won't be in the classroom. That's more than half. So if you have less than half of your teachers that are willing to be in the classroom and any of them get sick, there's nobody there to come in and take their place. And consider the fact that every time somebody in the building does get sick, that building has to shut down. Yeah. And it has to go through this cleansing operation before the children can be back. That could be happening all year long. So a great deal of disruption, many, many concerns, but it basically comes down to the safety factor. Nobody wants to open up. I did an interview 3 days ago, I think, with a sports reporter from the Washington Post here in the area. And he was talking to me about the Miami Marlins and saying 17 of their players have now contracted the disease. He says this is a baseball team. They have spent a lot of money testing their players every day. They've taken all of these precautions to isolate them. And yet all of a sudden, 17 players are sick. So he says to me, what's going to happen when several hundred or thousands of kids go into a school building? And I said, voila, You've hit it right on the head. If I'm watching a baseball game with an empty stadium, and now you're telling me that I have to pack 1,000 kids or more into a high school, self-contained environment, and nothing's going to happen, please be real.
Yeah, I mean, there's a lot of lessons, I think, to be learned. And as you pointed out, it's an ebb and flow, a lot of change, a lot of differences on the ground. Well, Dan, it was a pleasure talking with you. Thanks so much for joining us. Best of luck with all the plans reopening schools with all of your superintendents around the country. And we look forward to having you back on the program very soon.
Thank you very much, Jeffrey. I appreciate the opportunity.
Thanks, Dan. And when we come back, we're going to take a look at some of our best segments for the week. You're going to want to stay tuned right here on BRN Weekly. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms, especially for the smaller businesses? I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network.
The windows on our homes, they protect us and the ones we love, but they do much more. At Renewal by Andersen, making your home more comfortable is at the center of every window we make. It's why we custom build our windows in America and install them in as little as 1 day. It's why we build our frames with exclusive Fibrex composite material that's 2 times stronger than vinyl. It's why our glass helps keep your home warmer in winter, cooler in summer, and quieter all year long. It's why we stand behind every window with a 20-year limited warranty. Why not help lower your energy costs while giving your home and family the best? Call 1-800-835-6525 to schedule a free in-home consultation. Buy one, get one at 40% off with this special offer. Plus, get special financing with no money down, no monthly payments, and no interest for 1 full year. Renewal by Andersen, the better way to a better window. Call 1-800-835-6525 now.
Welcome back. On Wednesday, I sat down with Cybersecurity Collaborative's Parham Eftekhari about cyber threats and what consumers can do to protect themselves and their country. Let's take a look.
One of the things that people sometimes don't realize if they're not in this industry is that there is a direct correlation between some of the digital crime and cybercrime that they hear about in the news and what happens in their local community. And I'm going to give this out, explain this at a very high level. But a lot of times what happens, particularly when the crime happens not from nation states, but by cyber criminals who are have a desired goal of some sort of financial gain. There is a digital theft of some sort of data. That data is sold somewhere on these deep web marketplaces for Bitcoins, which are untraceable, right? Not like traditional currency. And those Bitcoins are then used to fund some sort of illicit activity. It could be to buy and sell drugs, to buy and sell illegal arms, to for sex trafficking, for child pornography. And those things eventually end up in your local communities. And so, I always bring this up because sometimes when we hear in the news about this bank got hacked, this hospital got hacked, this institution or billion-dollar company had an incident, it didn't affect you. If you didn't get an email about your information being breached, you think that it may not ultimately affect you, but you may be surprised how these things can trickle down and actually impact your community or someone else's community in our society, in our nation, in an allied nation. And so that's why these things really do matter and why cybersecurity is a national security priority and is really impacting all of us at a national scale. And I really like to make that point because I don't think a lot of people make that connection as easily as we think. Cybersecurity awareness is absolutely, continues to be one of the best lines of defense, and education does need to start from a very young age. We encourage K through 12 education around cybersecurity, both because we need cyber warriors in this fight, and there's a big shortage of skilled cybersecurity practitioners, and it's a very great paying job. So I'll give a plug for the industry right here. But also
Okay.
because but also because it allows us to, it enables us to ensure that when you are in the workforce, when you are using your device, you think twice before clicking that link. You look at the URL and ensure that the email, did it come from Facebook, or is it from, is the book spelled with 2 zeros, meaning that it's a phishing attempt?
Yeah.
It'll make you think twice about consuming that piece of social media, which could be propaganda or fake news from an adversary trying to, create some distrust in an upcoming election or some other nefarious activities. So awareness training is absolutely spot on. There's other things people can do as well. I think one of the biggest things, which we talked about earlier, is the fact that there's all this insecure technology out there. The reason that's the case is not because we don't know how to build better technology. We know how to do it. The reason it doesn't happen is because it's expensive to do, and it slows down the time to market for companies to release new products, which ultimately costs them money. And the reason they haven't changed this is because consumers continue to buy insecure products. No one is, for the most part, stopping their purchasing behaviors or changing their purchasing behaviors for security. We're just now starting to see that. So one of the biggest things consumers can do is to actually start to speak up, both with their voices and with their wallets, and demand that technology manufacturers, whether it's devices, software, applications, business, government, consumer, whatever it is that you're buying, ask questions about security and let people know that you chose to buy their competitor's product because you felt it was more secure. I will guarantee you that as soon as technology manufacturers start to hear that you're buying not just based on price and functionality and design, but also on security, security will skyrocket in terms of the priority list, in terms of product developments, and also security will be more embedded into the design process, which will reduce the amount of vulnerabilities that can be exploited by nation state and state actors. And so consumer involvement, just from a purchasing perspective, is critical. I think also, and there's so many things going on in society right now to engage your lawmakers on, but security is another one of them. If you have an opportunity to engage with your lawmakers, ask them about the plethora of cybersecurity bills being bounced around on Capitol Hill at the federal level or at a state and local level, and let them know that you support them in a nonpartisan way and that cybersecurity is important to you. And so these are some of the things that organizations can do. And a third one I forgot about is apps. Don't, just because there's an app that'll download, a photo of your face and make you look like you're 80, even though you're only 20, it may be fun and cute, but if you read the terms and conditions, and it says that app also gives them access to your contact list, your text messages, your phone calls, your camera, your microphone, and that app was produced by some company you never heard of in China, and you know that China has rules where they have a member of the Communist Party on the manufacturing floor or embedded in every company, you can believe that that's being used as part of some sort of a state-sponsored national campaign to exfiltrate data on all of our citizens. So don't download that app, regardless of how fun it'll be to have that photo of you looking 80. Those are things that we can do as Americans to protect ourselves and start to shift this tide of insecurity that we have today. Unfortunately, there's a lot of dysfunction and discord in government, but I will say, and I'm biased, I've worked in the public sector for not as an employee, but in that ecosystem for almost a dozen years. And I will say there's tremendous support and tremendous civil servants who care passionately in a nonpartisan way about defending our nation from a digital perspective. And there's a lot of great work happening, even on Capitol Hill. I'm the board chair of a cybersecurity think tank in DC. And one of our fellows, Dave Summit from the Moffitt Cancer Center, was just appointed as one of the, I don't want to use the wrong word, but there's a task force, I believe is the term, that was put together by Congress to deal with the robocalling epidemic that is affecting citizens, right? We all get those spam calls dozens of times a day, but it's also impacting hospitals and other types of organizations who are getting infiltrated with calls that are trying to exfiltrate PII from the healthcare perspective and others. And so, that's been set up by Congress, and they're working to solve it, and they're passing laws. And so there's a lot of examples of what Congress is doing that will affect change. But again, you're absolutely right. I believe that the biggest change that we've always seen in this country historically, regardless of what it is when people speak up and people let our elected officials know and corporations know that things matter to them, and we'll start to see change. I think we're seeing that right now in the country, and I think security can be categorized in that same bucket.
And on Thursday, I sat down with AAA's Jeanette Castellano to discuss Americans hitting the road again this summer. Let's take a look.
Yeah, I mean, overall, today's national average, we've been tracking about $2.19, which is still relatively cheap. It's 60 cents less than it was a year ago. So no matter where you are, you're likely seeing much cheaper prices than you were last summer, which is fantastic because, this summer, when people do feel comfortable traveling, they are going to travel by car. So that's a little bit of a perk when you are taking road trips. But ultimately, demand just isn't increasing at a rate to help knock out stocks. So while you are seeing gas prices increase in certain regions, they're not going to be anywhere near where they were last year. And you're going to continue to enjoy those cheaper prices at the pump for months to come. In fact, even throughout the end of the year, the highest price we saw in 2020 was $2.58. And again, that's the national average, but we saw that in January. And we're not sure that gas prices are going to come close to topping that between now and the end of the year. They do serve as an incentive, but what outweighs that incentive is the importance of staying safe and healthy. And right now, people, if they are traveling, they're not going to necessarily Disney like they typically do or traveling to other amusement parks. They're traveling locally, they're traveling regionally, so they are filling up. They're just not taking those extra long road trips because they want that comfort of health and safety when they do travel. I mean, we do know people are venturing out on RVs. I think they're probably taking more local and regional trips. And that RV is very appealing because they're in their home, right? They don't have to leave. They can leave if they want, of course, but they've got so much comfort of home in that RV that it just provides an incentive to take a trip that way. Well, right now, when it comes to traveling, Americans are making the decision to travel about 48 hours to 7 days before they leave, which is just not typical for summer. I mean, we are typically booking these trips months and weeks in advance. So we're waiting because we want all of the information in front of us in terms of where we're going to. Do we feel safe? What are the COVID numbers there? What is that particular? Do I have to quarantine when I come home? Or is that a state where I'm traveling to? Do I have to quarantine when I get there? So before we're deciding what kind of activities we're going to do, we are researching all of this information to find the best location. And most of those folks are probably doing local or regional, but really cities or counties, towns that offer a lot of outdoor activities, where you can practice social distancing and still enjoy a good time with your family. To help inform you, this isn't necessarily a one-stop shop. We definitely recommend looking at different resources. So one, the state, the town, the county, wherever you're traveling to, understand what they've got posted on their government websites. Visit the CDC website to understand their data tracker as it relates to COVID. But at AAA TripTix, which is triptix.aaa.com, you can route your trip on that using that resource, but also there's a link to the AAA COVID travel restriction map, and looking at that, you can understand more about any restrictions that are in place, but also things that are open, things that are closed, to help inform you as you plan your trip. And what it comes down to is consumer confidence, right? When someone feels comfortable that they can travel, they're going to travel. And right now, that mode of transportation is by car. We expect 683 trips between July and September. And it's also summertime. People have saved all this time off and they want to take vacation. They're going to, it's just going to look very different. So we're not really expecting those 1, 2, 3 week extended vacations. It's looking more like a weekend vacation or an extended weekend. Something where you can make those last minute decisions, feel comfortable when you book them that you're going to take that trip, not necessarily planning something now for September that you could ultimately have to change or cancel trips. But again, it's going back to that car trip because it's comfortable, you can control it, as opposed to being on a plane, being on a train, when you're exposed to so many more people and you don't have control over that environment.
And that wraps up this episode of BRN Weekly. But as you know, we're not done for the week because tomorrow I'll be joined by members of academia, financial services, and the media to analyze all the news in retirement markets, technology, personal finance, and more on the BRN Sunday podcast. You're not going to want to miss this show. It's going to be another great one. So until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.
Attention! The Centers for Medicare and Medicaid Services has officially authorized new benefits that Medicare Advantage plans may include. To get the benefits you deserve, you can call the Medicare Coverage Helpline.
Hi, I'm Joe Namath. If you're on Medicare, this is important information. I called the Medicare Coverage Helpline and they instantly looked up my coverage. In this one simple call, they offered to enroll me in a plan that includes rides to medical appointments, private home aides, doctors and nurses' visits by telephone, and even home-delivered meals. The plan also includes dental, vision, hearing, and prescription drug coverage, all at no additional cost.
Don't delay. Call to see if the new benefits are available in your area.
Call the number on your screen now. It's free.
Call 1-800-757-1451. That's 1-800-757-1451.